Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic MedEd learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia in the brain, we will discuss cognitive decline after surgery. To help provide insight into this topic is Dr. T.J. Gann, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
Let's talk a little bit about this cognitive decline post-op delirium, which I think is underappreciated. And we know that cognitive delirium, post-op delirium is associated with very, very high cost. As suggested here, it's very common and it can happen to many patients, in particular the elderly, and it increased hospital admissions, increased complication rate. So clearly is very, very expensive. And this again shows you that it's associated higher mortality as well as longer hospitalization. And it is not uncommon. So in particular, surgery such as coronary artery bypass graft, AAA, hip, because mainly in elderly population, the incidence is in the range of between 30 to 65%. And even in ambulatory procedures, studies have found that patients do not return to their baseline even up to a week after an ambulatory procedure, as shown here, that the cognitive recovery can take a little while. Now, we also have evidence suggests that if the patient is deeply anesthetized, as this study show, if you have a patient that demonstrate burst suppression. So in other words, if you were to hook up the BIS, these numbers are in the teens, in the single digits. The longer you have the patient in burst suppression, the higher the incidence of post-operative delirium. The incidence can be as high as 35% if the burst suppression is more than 17.4 minutes. Now, there have been several studies that have shown the correlation between depth of sedation and the incidence of post-op delirium. I want to share with you 3 studies. The first one is by SIBA. These are prospective randomized double-blind trial over 65 years of age for a patient undergoing hip procedure. Essentially, they looked at propofol or midazolam sedation. Patients who are either targeted BIS of 50 or BIS lighter group or sedation group BIS of over 80. And again, you can see that the lighter BIS group was associated with a lower incidence of delirium compared to the deeper BIS level groups. And this, another patient, again, looking at similar population, 65 years old, total hip arthroplasty. This is patients receiving blocks, the lumbar plexus block, as well as being sedated. One group had a BIS of 60 to 80 under sedation, the other group under general anesthesia, 40 to 60. And again, you can look at the incidence post-op delirium was 55% lower in the sedation group compared to the deeper BIS group under general anesthesia. This studied a large number, over 1,000 patients, again, elderly population over 60 years of age, having general anesthetic, and they randomized patient into a BIS guided group versus routine care. The BIS guided group targeted BIS between 40 and 60. And they found that patients who had the BIS targeted anesthetic had a 22% reduction in the incidence of post-operative delirium compared to those who were cared for under routine care. And they screened post-op cognitive delirium, cognitive dysfunction, pretty long, 7 days as well as 3 months after surgery. And another large study by Matthew Chan from Hong Kong. This is just under 1,000 patient study, non-cardiac patients, and again, randomized into BIS guided versus non-BIS guided or standard of care group. And the BIS guided group, the anesthetic titrated to BIS of between 40 and 60. They implemented neuropsychological battery of testing at 1 week and 3 months after surgery. And what these are some of the tests that was done, from verbal fluency test, the learning test, psychomotor test, and at pre-op, 1 week post-op, and 3 months post-op. And what they found is that, as what we found earlier, the BIS titrated group used less anesthetic, propofol and volatile anesthetic agent, 20 to 30% less. They found, as we found earlier in our study, earlier emergence and shorter PACU stay. And but they also interestingly found that the BIS guided group had about 35% reduction in the incidence of post-operative delirium compared to the routine care group. So that is pretty significant of all the study that I've shown you, and they all have shown a reduction in post-op delirium. So they concluded in this study that for every 1,000 elderly patients undergoing major surgery, if you titrate the anesthetic using BIS between 40 and 60, in 1,000 patients, you could prevent 23 patients from post-op cognitive dysfunction and 83 patients from suffering post-operative delirium. So that is a significant improvement using BIS monitoring. These are the 3 studies that put together by a group that from Thailand that look at the meta-analysis. And if you put all these 3 big studies together, you will find that the overall effect is that there was about a 30% decrease in the incidence of delirium with BIS monitoring, keeping between 40 and 60. And also a decrease in the post-operative cognitive dysfunction at 12 weeks when in the group that received BIS monitored care. Now, there are also a number of studies, and this is a meta-analysis of about over 7-8 studies that show that if your anesthetic level is kept too deep, and that is defined as BIS under 40, the incidence of post-op outcome, in other words, these are typically mortality, seems to increase with a very deep anesthetic. And there was a editorial which summarized from these studies that deep sedation is associated with a high incidence of post-op delirium, other adverse cognitive outcomes, and increased mortality in elderly and critically ill patients.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.